Afternoon. Welcome back. I will reconvene the regular meeting of the Board of Lane County Commissioners for Tuesday, June 4th, 2024. Welcome back to those of you who are with us this morning, and welcome to folks who are new in the hall for the day this afternoon. Our first item up is a 1:30 time certain, so we'll dive right in with an item from Health and Human Services, which is a report and discussion on Behavioral Health Division mobile crisis expansion and also on the co-response model in Lane County. And with our administrator at the table is Dr. Pauline Gishoui and our Director of Health and Human Services, Eve Gray. And I'm going to turn it over to our staff presenters and we'll dive right in. Thank you for being here.
Thank you. So Dr. Gishoui and I will do the first portion of this presentation, which will be an update to the community on mobile crisis expansion. And it was our intent to have Executive Director Gates from Whitebird here with us. There was a last-minute scheduling conflict that happened, but I do have some slides from Whitebird that I will be presenting as part of that presentation. We have been closely aligned and connected in the development of what this is going to look like going forward in the metro area. We will then give you just a little bit of an update. We don't have a lot substantive about process in Western Lane and mobile crisis response in Western Lane, which has been provided by Western Lane Fire and EMS through a contract with us with pass-through state funding. And then we have Incident Commander Brown from the city of Eugene and Sheriff Harold, whom you all know, who will be here for the portion on co-response and to talk about what is the co-response model, or what are the co-response models that we have implemented in Lane County. And we'll talk a little bit about how that differs from mobile crisis, but is still an important part of the overall system. So that's what to expect for today, and I will turn it over to Dr. Gishoui for the first slide.
All right. Good afternoon, everybody. I'll start with kind of where we started with this evolution of mobile crisis. So this is not necessarily new, although I'll get into the enhanced rules that are fairly new. But mobile crisis has been a requirement of the state since 2018. And we had some allocated mobile crisis funding in 2018 following a USDOJ settlement with Oregon. Unfortunately, the funding, as is usually the case, wasn't enough to have a full-blown expansion even then in Lane County. So for some of you who were here then, we were trying to look at some pilot projects to expand into the rural communities, as was the expectation. And we'll talk about Western Lane, which was one of those pilots from when we got the requirement of having access to mobile crisis services in 2018. Part of that is the requirement of the community mental health program, or actually I should go back a little bit, the local mental health authority, which is the Board of Commissioners, having the responsibility in the community for how behavioral health services are delivered in our community. So that responsibility for access to mobile crisis services rests with the local mental health authority, which in turn that delegated authority is with the local mental health, the CMHP, which is where behavioral health kind of takes on that responsibility. So prior to 2018, a lot of communities in Oregon were trying to meet the need in various different ways. There was not one standard way that communities were meeting the obligation. So there's different types of models, different kinds of ways that people organize themselves to meet the need. And if you talk to one county, it's very different. It's just very unique in how they utilize the dollars to expand mobile crisis. So for most of the community mental health programs, including Lane County, we still continued with the gap. So wasn't enough, like I said, to expand mobile crisis to the entire community. So we've been limited in terms of access and trying to do the best we can with the funding that we have. For Lane County, we are fortunate. For the child and youth services, we do have countywide response through the through Riverview Center for Growth. Most of you know it as the Child Center, as it used to be called. So they provide through contract with Lane County to provide youth services, mobile crisis services. We have had Whitebird or Cahoots program that has been covering the adult population, but primarily in the metro areas. We haven't had services anywhere else outside of metro other than the pilot that we started in about 5 years ago in Western Lane. And we'll talk about Western Lane in a little bit. We did want to take a few minutes to highlight Cahoots, which has been key in our community and an example of mobile crisis. So Director Gray will speak to the Whitebird Cahoots program.
Thank you. And as I mentioned, these slides were put together by Whitebird as an organization. So Cahoots was founded a long time ago, 1989, and has provided an alternative solution for police and fire response for mental health and physical health needs. So Cahoots has both behavioral health professionals as part of their units and paramedic professionals as part of their units in order to provide that combined and more holistic response. Their vans, and that mentions mental health crisis worker and a trained medic, and that really does allow them to respond to kind of whole person needs, which is a really fantastic model, and one that unfortunately, as we're moving forward, there is a splitting of the services between behavioral health crisis services and physical health response services for what we are required to perform. But we are very glad that Cahoots continues to be a partner in our community and will continue to be a partner in our community providing this kind of holistic response. And I think many of you know, or all of you know, that Cahoots has been recognized nationally and at times even internationally for the services that they provide, has served as a model for many communities in how they can create response to calls that don't require law enforcement or don't require other forms of first responders, and provide appropriate behavioral health care in particular. But like I said, often the issues go together, behavioral health as well as physical health, particularly when responding to people who are in crisis on the streets. And has a proven track record of reducing calls to fire and EMS. And it was really this success that that Cahoots was having within our community that caught Senator Wyden's attention in order to pass some legislation that Dr. Gishohi will talk about in order to bring Medicaid funding into the mobile crisis system. So really important foundation for the work that we are doing. And all of this is evolving. So as the rules evolve, we really want to support Whitebird to continue to provide the community led, community-initiated, community-driven programming that they have been providing. So we are focused on continuing to support them in that pathway, even as we are adding services to our community related to an enhanced mobile crisis response in particular. Okay, should we talk about the Cahoots Act?
Sure. So we had the opportunity. So I think of these as phase two. So 2018 we had some funding which didn't go very far. So I'm thinking of this as phase two with Senator Wyden's championed Senate Bill 764, which he called the Cahoots Act, and that has allowed the ability for states to tap into the federal revenue in terms of getting a federal match. And I'll talk about in relationship to the rules and how that ties together. And with Senator Wyden's bill, it also kind of ties with the adoption of the SAMHSA Crisis Now model that was published in 2020. It's an 80-page document that talks about the ins and outs of how the federal government wants to manage crisis, or guidelines that are supposed to guide how we respond to crises. So if you want to look at that, it's the National Guidelines for Behavioral Health Crisis Care. It has several authors, one of who are, I think most of you are familiar with RI and the Connections program in Arizona. Some of those were contributors to the SAMHSA national guidelines. And those specifically call out as regional or statewide crisis call centers. They are looking at or advocating and recommending central that the crisis model is centrally deployed. They're looking at 24/7 mobile crisis and what they call crisis receiving centers, and also essential crisis care principles and practices. It's a very well researched document. I would encourage all of you to take a look at it. Just well researched based best practices on how we can improve how we deliver care. So that was published in 2020. And at the same time, that was when Cahoots was getting a lot of national attention as well, with some of the challenges that we were seeing with racial unrest and the challenges there. So Senator Wyden championed that bill. We have since in Oregon adopted the Crisis Now model, so OHA adopted that model and came up with House Bill 2417 that has directed this, the registrator directed OHA to design, establish, and implement a crisis system that aligns with SAMHSA's Crisis Now model. So we have been looking at that, using also just being mindful of what we have in existence, our crisis system infrastructure, and how to do these in those in that system. So we had through that bill had some funding that was to help counties have expansion or startup to expand mobile crisis. And OHA's vision with the House Bill 2417 was to make sure that mobile crisis was accessible to the whole lifespan, that anybody who needed that could access that, that mobile response and stabilization services were available for youth and families as well. And those requirements are also memorialized in our county financial agreement and the CCO agreement. So that is all part of ensuring that we have, we are implementing the Crisis Now model as adopted from the federal guidelines. So in terms of the rules, so like I said, we've had rules since to expand mobile crisis since 28. So this is just what I'm referring to as enhanced rules that incorporate these the federal guidelines. So you will find the rules under OAR 309-072-0100. And it's a lot of guidelines too, but I will highlight some of the most important ones, or ones that we are paying attention to and that are critical in implementing the model. So the rules require that mobile crisis teams are staffed by two people, and those have to be eligible and certified worker types. So we have in behavioral health, qualified mental health professionals, or what we call QMHPs. We have qualified mental health associates, or QMHAs, and peers. And the federal guidelines really do stress having peers involved in the crisis response. So they are part of the two-person response team. They have, there is also a requirement of certification through a COA, certification of approval. So there's a process that teams have to go through with OHA to be qualified to provide this service as defined in the federal guidelines. We also have to have specific response time. So it's getting the service to the person in a timely manner. So we have those guidelines in the metro area, being able to respond to individuals in distress within an hour. In the more rural communities, we have an allowance of 2 hours. And I say that knowing that with somebody in a crisis, 2 hours is a long time. So it's trying to also being mindful of how we, even with those being the minimum requirements, that we also are responsive, that we could do, we could be timely in our responses for somebody who is needing help. In a crisis, when you need help, you need it now, not 2 hours or 3 hours from when the crisis ensued. The rules also require that the response is independent of law enforcement, that it's not an automatic response by law enforcement if it's a purely true behavioral health response. This is not to say that responses cannot include law enforcement, and we'll talk about call responder, which is also best practice that have a call response with law enforcement. There is a place for law enforcement, but the rules requiring us not to always be using law enforcement for behavioral health distress. The SAMHSA guidelines is to use the least restrictive interventions as often as we are able to, also recognizing that there are times that we will need to have law enforcement involved in crises. And that is also to say that there are also times that having coordinated responses both for mental health and law enforcement is the right thing to do. I was in a meeting last week or a couple weeks ago with Senator Wyden's team and some of my other peers in other counties, and we are talking about this and how we do integrated behavioral health services. So it's not, behavioral health versus law enforcement, but how we really look at having a coordinated response as much as possible. And we were talking about a few of my peers give these examples that I think highlight how important it is to have that collaboration versus looking at bucket or looking at a separation of these interventions. We are talking about the same people, so how we support those individuals given a unique skill set. Behavioral health brings a unique skill set, and so does law enforcement, and all those critical depending on what it is that we are faced with in an event. So there was these two examples that I think kind of highlight that. one individual was going to be arrested. There was no question about the outcome. The outcome was going to be an arrest. And this team coordinated, the law enforcement coordinated with behavioral health to say, we are going to arrest this person. They are an individual that we know. But I think with you going with us to this arrest, it might mitigate, this event becoming worse. And so they responded together. Like I said, this was not a question that the outcome was going to be an arrest, but that coordinated effort actually minimized a potentially dangerous situation that could have ensued if it was just law enforcement responding. The other individual that was highlighted in that conversation was somebody that was going to be evicted from their resident. That again was an individual that both behavioral health and law enforcement are used to responding to. So it's a well-known entity. Again, the outcome is an eviction. And again, the team joined forces to say they're going to be evicted. There's no question about that. But how we do it together will probably minimize the potential outcome of that. So both of them very trauma-informed and not really looking at these versus the other, but how we meet individuals' needs in the most trauma-informed way. And we're doing that with law enforcement. So for me, when the rules say, requires non-automatic response, yes, for when we believe that that is the right thing to do, but there are opportunities also to correspond and mitigate potentially dangerous situations occurring. The rules also do require enhanced training, so there is a curriculum that has been developed through Oregon Health Authority and the Association of Oregon Counties and Mental Health programs to make sure that people who are responding have the tools, the skills to be able to do this well. So it's a week-long training, very well thought out. The curriculum also has scenarios, real examples of scenarios that they would expect to see in the field, and just guiding staff through what to expect, what to do in some of those situations. So those are some of the rules that we are looking at and are part of the requirement of being a certified mobile crisis team. I also wanted to kind of look at the process that we've gone through to get to where we are today. So when we started looking at how to cover the entire county, we got together, behavioral health convened a lot of stakeholders. I know a few of you commissioners were a part of those initial meetings with stakeholders to look at how we designed this. I was acutely aware that all the regions, all the different areas in our county are very different and the needs are very unique. So what you see in the metro area may not necessarily be what you see in a rural community, and may not necessarily be the needs that the rural communities would want us to know in those communities. And it has been a very enlightening process as we kind of gathered and looked at what those needs are and how we partner with the various entities on how we come into this space and how we are going to be corroborating on what is showing up in their community. So we convened, like I said, all stakeholders, those law enforcement, the cities, people who are doing this work already, and looked at what we have currently in terms of teams, in terms of funding, and identified a path forward. So we convened in May. The first kickoff meeting was in May, but prior to that, we had other meetings with stakeholders just to bring them up to speed on what the new rules, the requirements are. By the end of the meetings, we kind of had identified a need for project management. It's, somebody, a full-time employee that would be looking at how to design this work and what is needed. We also identified a need to secure funding, that we didn't have all the funding that we needed to get to the compliance by rule. And then we started looking at partnerships, teamwork, collaboration, what existed and what the teams that were in existence, what needed to happen for them to be at full compliance? What are those? What are the challenges? What would we need to move them to be at that place of compliance? So we kind of had come up with different designs, different models, and looked at pros and cons of all those models. A part of that was looking at, would there be an opportunity for, fire EMS? Would there be opportunities for looking at just being creative with what it is that we were trying to come up with? At the end of that, most of the recommendations were looking at the best program being one entity that could do the whole county coverage. What would that look like? And unfortunately, we did run RFPs, requests for purchases, to see who might be well positioned to cover the expense, which is Lane County, and we couldn't find any providers that were ready, willing to be the provider for the entire community. So we actually ran an RFP a couple times, I believe, and landed with not any one entity being able to provide that service. So we have since decided that because we couldn't find any provider, we as the CMHP, the Community Mental Health Program, have the obligation and responsibility to have this service available to our community. So the county is stepping into this space, as you all know, to expand that service. What we are looking at is the opportunity to integrate crisis lines, triaging, mobile response, dispatch, and standardized services for all community members. So we've gone into a process of inviting all our stakeholders, law enforcement, how to do dispatch in a centralized way, as SAMHSA guidelines ask us to do. The best approach to delivering this service is that kind of centralized process. So we're looking into that and how we do that as a system. And like I said, Lane County will be stepping into, Lane County Behavioral Health will be stepping into that space. As Director Gray had alluded to before, Cahoots will be still in the system, but will continue to provide alternative responses that are appropriate with in that continuum. As I look at it, it's a continuum. So what we are building is these services that we haven't had for a very long time, and trying to figure out how we build that continuum. So looking at, those services that Waibeta or Cahoots has been really good at, looking at those human types services, welfare checks, those services that are not necessarily going to be the focus of Lane County's mobile crisis, which is going to be more of the acute crises. Those are going to be our focus. And the we are fortunate to have those layered services, that there are other people who can attend to these other services while we respond to the high acuity. Riverview Center for Growth will continue to provide the response for youth, and we are looking at ways to also kind of just beef up that program and make it more available and known. A lot of people, as I was going through, a lot of our rural communities didn't seem to know that we have that statewide youth response. So it's also getting them more exposure to the rest of the community. And we are looking at additional resources. Again, it's that continuum. So how do we do warm handoffs? Who is going to be available to provide the next layer of services once that crisis has stabilized? So we have the opportunity to integrate or interface with 988, which is the Crisis Now model, and how to utilize other services, walk-in services, the co-responder service, our FIT program that is also a mobile service, and other outreach services. So it is an integrated system versus each of those systems operating in a silo. So our timelines, it will come as no surprise to all of you that we are not fully funded. So we are still looking to additional funding. And because we are not fully funded to provide 24/7, which is the recommended and required by rule, we are going to start at 8 hours a day, 7 days a week. This is also based on our ability to hire and recruit for staff. We are experiencing, again, this is not a surprise to all of you, we have an acute workforce shortage, especially with the qualified mental health practitioners, the master's level clinicians, which is a key critical requirement for us to be able to assess, evaluate, and then triage, clinically triage folks through the crisis system. So that is challenging. We are hopeful that we'll be able to start with 8 hours, 7 days a week. But again, that is also anticipated to be determined by how quickly we can hire and train staff. We hope to cover as much as possible, working along with city partners to develop standards for how we dispatch, who gets dispatched to what calls, now that we have these different layers of services in our community.
And I think since Western Lane is referenced on this page, I'll just take this opportunity to say that we have spent a lot of time talking with Western Lane Fire and EMS about the requirements, and also working with the Oregon Health Authority on what we could do to support Western Lane continuing to provide services within their community, because it's a unique locale, and it is isolated in many ways, with Western Lane area from the remainder of the county. So we are continuing those conversations. As of today, we do not have authority from OHA to spend the dollars we have been spending, to continue to spend those to support Western Lane Fire and EMS, because they do not have a current certificate of approval, or COA, which was one of the requirements that Dr. Gishohi mentioned. We are reaching out to the Oregon Health Authority because Western Lane Fire and EMS has submitted an application to receive a COA, and we will be asking for permission to continue to pass through funding while that application is pending. We don't yet have a response to that. And then, of course, we would need for them to become approved and to hire the right staff and to do the right training. The other thing that is a little bit challenging for us is that a large proportion of our mobile crisis funding has been going to Western Lane Fire and EMS. And now that the expectation is full county coverage, that impacts the percentage of funds that can go to Western Lane to support this service specifically compared to what we are providing within the remainder of the county. So we are also in close conversations with Western Lane around what the realities of a budget for a new program would look like, so that they have an idea of whether that might create service disruptions for them, even if we are able to continue funding them. So that's the current status on the Western Lane side. We really are working with them and trying to help them to be successful in running their own program, and it's tricky.
So this slide, we wanted to show these just as we have the different types of services, just to kind of show how the other communities are utilizing the different services within a particular region. So this is Multnomah County, which has Project Street Respond and Portland Street Response and Project Respond. So Portland Street Response is actually very similar to Cahoots. I believe Cahoots actually helped consulted with Portland Street Response to build their program in Multnomah County. And the Project Respond is the county response. So this will probably look very similar to how we are envisioning having these two services in our community, where primarily we will be seeing like Portland Street Response will see more of Cahoots being in the kind of the street response, medic, physical type responses, whereas the county, which is Project Respond, will be primarily in the more acute behavioral health distress. And again, we work with people, so there's going to be some overlap and some gray areas, and again, is figuring out as a community what makes sense, what are the right calls. And sometimes we might go to a call and realize very quickly it's not, it should be the other party responding. So as long as we are coordinating and as long as there's those warm handoffs from each of these different teams, we should be able to manage these. It's proven to work in Multnomah County, where they have these two teams and two systems and ability to be able to dispatch them to the right teams. So it's going to be bumpy, I'm pretty sure, but we will figure out as we enter into this space how we dispatch to the right, dispatch teams to the right call.
And I think that is the end of the mobile crisis portion. So just in summary, because that was a lot of information, Lane County will be starting a mobile crisis program, and you have an agenda item right after this to approve some additional positions that we didn't know we would need when we didn't think we were going to do basically the bulk of the county. But at this point, we know for sure we will be providing mobile crisis services under our own COA in order to meet the new mobile crisis requirements for behavioral health crisis response for all of the county with the exception of Western Lane, and we are still waiting for the answer for Western Lane. So that speaks to those additional positions that we are requesting. This does not supplant Cahoots as a service within our community. Instead, it is an addition to the services available within our community. I think that we all know that Cahoots has also been overwhelmed. The need in our community is really significant. So this is an add to the service within the metro area, and it is a new service available within rural areas or those communities outside the metro area. So that's the summary of how the various entities are right now thinking about interacting. And as Dr. Gashohi said, we have systems work to do in the metro area to understand who is dispatched to which calls and how we are working together collaboratively as a system. But this is where we are. So happy to entertain any questions on the mobile crisis side.
Thank you so much. To the board. Commissioner Farr.
Where do we start? A wonderful presentation, and you do it with a smile on your face, and I admire you for that, because I see an untenable situation here. You know, you talk about it, that there's a model that works in Multnomah County. Multnomah County is a predominantly metropolitan area, and it's covered not only by, well, it's covered by Metro Police Departments, for one thing, and it's got a lot more facilities for medical response than we have. We are a county the size of Connecticut. We stretch from the top of the Three Sisters to Hasita Head, from Waldo Lake to Neptune State Park. So not only do we have the staffing issues, which you so eloquently stated, something that everybody in this room knows about, we also have the funding issue, and we also have the geographic diversity of a county that has volcanoes and potential tsunamis in the same county. So, you know, now I don't want to present a doomsday situation, but to me it's another situation where the authorities, in this case, I guess it's OHA, that said, I'll just go ahead and do it. You know, okay, well, we'll try to do it, but the Cahoots model doesn't work as you described because of some of the restrictions that Cahoots either places on themselves or just a natural part of of the way they do business. But I'm not convinced that without some extraordinary effort on the part of the state, that we're going to be able to do it. You're putting your best foot forward, and we're doing the best thing that we possibly can. And by and large, Western Lane is doing a good job. But it's taken what percentage of the entire funding for the whole county? You know, what, more than half of it, perhaps? That's, you know, you're probably not equipped to respond to that. But you know, it's another part of the situation is that we have different types of response, and who knows when the mobile crisis response team heads out whether or not law enforcement is going to be required. And if they get there and law enforcement's not alerted already, then how are they going to get there in time to prevent an escalation of events? Now, once again, I'm not trying to point out all the negatives. I'm trying to point out how daunting the work is ahead to put the system in place. It has to click on all cylinders. Everything has to work precisely, and we also have to have the cooperation of the higher authorities who are raining down the information, you know, the requirements upon us. Once again, you're still smiling. And I'm not trying to make you not smile, but the fact is, you know, it's not a very easy situation for us to address, and doing the best you can, you need the full cooperation of this Board of County Commissioners to allow you to do the work that you need to do, daunting as it is. And sometimes you head down an alley and you don't know what's on the other end of the alley. You know, it's I see that in your work. I think you know, we look at Riverview, and a large percentage of their responses, and they do a superb job, there's no question about it, but a large percentage of their responses are handled over the telephone, which is it easier for youth over the telephone than with adults over the phone? That's probably just a rhetorical question, but I guess, can you predict how much of this work can be done without dispatch? That's probably an unfair question.
It is. It's daunting, to be quite honest, and I appreciate you validating that, because it has been quite the journey, and we are still trying to piece some of those yet. But by and large, based on the data and research, even with the SAMHSA guidelines, a lot of these calls can be resolved through phone. So you don't not every call requires a mobile response. A lot of them really majority of them can be resolved by phone. So it's that crisis now model, the call center. So the call center is supposed to respond and de-escalate majority of the calls. There's those that are going to require the additional sending somebody else to continue and lay eyes on the situation. But by and large, they should be able to be resolved by phone.
And I'm not going to grill you with questions that we don't really have the answers to, but, one impedance is the COA. Now, Western Lane has applied with COA, and they've not got it yet, and they've not got it yet, and they've not got it yet. So how long is it going to take for the approval to take place for Western Lane, which has a relatively small geographic response area? I think, once again, I'm not asking you to answer that question because you don't know the answer, nor do I until we actually see the answer in place. But it's going to require everybody working together, and I'm afraid that the higher level authorities that are raining down these, I'm sorry, I apologize for that are giving us these requirements aren't ready to give the support that is needed for us to achieve the requirements successfully. I'm excited, and once again, you need the full support of this Board of Commissioners and everything that we can do to make this happen, because it is huge. Once we get this in place, it will make that man's job a whole lot easier. In fact, it'll make, I'm not pointing at you, Steve, I'm pointing at the man in the tan shirt behind you. It's going to make everybody's job a lot easier, but better yet, it's going to provide service to the people who are in crisis, who need a certain kind of help right now. And of course, we need the facilities, we need the funding, we need the workforce, and we need the cooperation of all entities involved to make it happen. So,
What I will say is that I do think that the staff at the Oregon Health Authority are working really hard on this. And I think about all of the initiatives that they are being asked to implement now as well, from mobile crisis to stabilization center services to Medicaid 1115 waivers that include housing supports, food and nutrition. And as of July 1st, 2025, they are anticipating carceral settings in youth, 6 months later, adults. There's so much that we're trying to do all at once. And I think it's being felt at the state. It is being felt locally that it's like everything is on fire. So everything is a crisis and we have to do it right now. And then that overwhelms the capacity of everyone at the local and at the state level. I think that's what we're seeing at the moment. But you're right. In order for us to do this successfully, we need more funding. We probably need some more flexibility in the regulations, and particularly in the funding rules around when you have to have a QMHP present and when you don't in order to get what rates of funding. We have to recognize the workforce crisis in the midst of all this. But I do think that OHA is working with us. It's just tough to try to do all of this at once. And yet, like I said, the need is so urgent. So you comment on us smiling. It's that or we break down in tears, and that doesn't feel very professional. So we'll just keep smiling.
keep on smiling. To illustrate the daunting nature of this, you put out 2 RFPs and didn't even get a respondent. Oh my gosh. Thank you, Chair.
Commissioner Seneca.
Yes, thank you, Chair. Well, I think you will have all your feelings validated about being overwhelmed. I mean, this was overwhelming when Western was going to work for us, right? So, I mean, just as we're gaining, now we're losing. I don't need to reiterate everything that was already said, but I do just want to take a second to thank both of you for how hard you have worked to try and get Western. I mean, including me in all the meetings and updates and progress and not progress. So we do see how hard you're working at this, and this is one of those things that everybody is pushing for because it could help on so many different levels. So, thank you.
Commissioner Buck.
Thank you, Chair. I appreciate the sentiments of my fellow commissioners. Other than Multnomah, which you have up here showing us what they're doing, how many other counties are really embarking on this the way that we are, and how are they working through the same dynamics that we're facing? Or are they?
They are, and our counties are very different in the way that they are organized and with the way they do this work. I have to say, for Lane County, we are a little behind in our implementation. Most of the counties had already had mobile crises that are county run. So for Lane County, we have the unique. We're unique in the sense that we have a lot of subcontractors, and a few of the other counties are that way too. But most of the other counties have county-run mobile crisis, which for them, and granted, some of them are not as large as our county, so there is that ability to use the staff in the different ways that they see fit because it's within one organization, so they can pull staff to work in different areas. I'm thinking of Deschutes, for example, which has a stabilization center. So it's under one umbrella. So it's mobile crisis, it's stabilization center, it's, the walk-in services, all under one, the direction of the county. So there is the flexibility to be able to do things differently. That said, every single county is experiencing the same workforce challenges as we are at a time that we are being pushed to expand and add, two-person teams to be the model. So in terms of challenges, we are similarly experiencing the same growing pains and the same challenges with workforce.
I think the only thing that I would add is that that this model, we pulled it up not because it is representative of what we think should happen in all of Lane County, but representative of what we think will work in the metro area. We have a long history of having Cahoots in our community available to respond to a very large variety of calls. It is our estimation that only about 30% of those rise to the level of a true behavioral health crisis that we would be responding to as the mobile crisis provider. And so without having the dual response, what we would see is a reduction in service in our community and a reduction in the ability to have an alternative response to support police for other street level concerns and challenges. Dr. Gishohi mentioned welfare checks. Trespassing calls are another one where often there's a behavioral health component to those particular calls, and a police response isn't the most appropriate one. So having the dual services will continue to allow our community to have access to the response to the variety of calls that have been responded to historically, and otherwise we would be, if we supplanted Cahoots, we would be looking at an overall reduction in service in our community, which was not our goal.
Vice Chair.
Thank you, Chair. Yeah, it's overwhelming. I mean, the data and the amount and the stress and the pressure I feel on you is daunting, and congrats for, plowing through it and not crying, as you had said, Eve, that you're not doing, so good for your courage. Having lived through a number of these mobile crises in my own family, I know the importance of what this work is to the community. It's unfortunate that we're having to do it under a, put out the fire kind of routine and mentality. So I can only yearn that we can get through this and make it work. And the other question I had was, I'm a little confused a little bit of how Cahoots is fitting into this model again, because as we understood it maybe a year ago, Cahoots was kind of off the map as far as helping contract through Lane County. So I had that one question. And then the other question I had was, it seems like the master's level of people to staff keeps coming up, and I'm just wondering if that career path is stabilizing, growing, shrinking. I mean, cautiously optimistic. What's our outlook on finding people that are actually heading on those career paths?
Good questions. So in terms of Cahoots, Cahoots is primarily funded through the cities. So nothing about the mobile crisis changes impacts, at this point, any of the municipal funding. We're not aware of any changes. There is a smaller percentage of funding for Cahoots that has come out of the County Financial Assistance Agreement. So that's state funding coming to behavioral health that is now in that pot of funds that we can't use for a provider that doesn't meet the statutory requirements. So we are trying to identify funding. We are optimistic about identifying funding on the HSD side in order to keep Cahoots whole in terms of our portion of the funding. But it continues to be true that we cannot use the mobile crisis funding in order to fund Cahoots services going forward. And then on the workforce piece, that's complex. I saw a presentation that said we actually graduate more master's level behavioral health clinicians than most other states in the state of Oregon. I think we're like third or fourth. I mean, it's high up there. And what we're finding is that clinicians are going direct into private practice. And they're able to, without a license, because when you graduate, you don't have a license. It used to be that you would go for 2 years in community mental health. You would get the supervision that you needed in order to achieve licensure, and then you might consider taking the next step into private practice. People are skipping that step altogether right now, and we are losing folks in community behavioral health. And the mental health crises in our community are so significant that there's plenty of work to be done in the private pay and commercial market, and even Medicaid continues to pay unlicensed clinicians to do behavioral health therapeutic work. We are anticipating that rule be reversed on the Medicaid side in the near future, which we hope will push more people into community mental health. But there are some real systems problems here that are preventing us from being able to serve the most vulnerable people in our society with the clinicians we are able to graduate. So we are going to be applying for another grant. Future Ready Oregon is the next grant that we're going to be applying for to really try to do some work with paid internships for students and then asking them to commit to community behavioral health, not necessarily Lane County behavioral health. It could be a nonprofit in Lane County because we want to work with our nonprofits, and also providing supervision support for licensure, because a lot of times nonprofits can't pull in unlicensed clinicians because they don't have someone to supervise. So we want to hire someone to do that in order to support not just our capacity, but the nonprofit capacity in our community as well. So we're going to go after that funding, and there's everyone and their sisters going to be applying for it, but we will remain hopeful.
Oh, great, thank you. I just want to also shout out to the public safety and sheriffs and EPD and SPD forces. They have trained some superior individuals to fill the gap in case that the mobile crisis team's not there. Personal experience has been you guys are doing a great job. You've trained your people well, and I just want to commend you in public for that, so thank you.
Well, before we move on to the co-responder, thank you for all of that. I think the one thing I would say when Commissioner Farr was speaking, I was thinking all of that is true and we need all of that, but we also need to start somewhere. And I have to believe that when we start having some real on-the-ground experience and specific examples we can bring to OHA and others, it might also help accelerate the response and the adaptations and the funding that's needed. It's still all quite theoretical. So, so there's that, hopefully, to come of it. The only question I have at this time is very, literally as far upstream as you can go practically. I still want to understand, especially when I look at this, when you say, you know, a lot can be handled over the phone, then it gets triaged to determine, is it the FIT team, is it Cahoots, is it our mobile crisis, is that our central dispatch is the first point of contact? Or, I mean, I guess it's if someone calls 988, it's 988, but otherwise it's our central dispatch. So where is the training in them determining then where the call goes to?
We are working with all our partners to figure that out, and we are going to be, and the sheriff is here who could probably speak more competently on this than I can. There's a lot of in the weeds work that's happening to make that happen, but it's 9888 and 911, but a lot of our dispatches will happen through LCSO.
Okay,
Yeah.
great. So to the consumer side, they're dialing 911 or 988 or non-emergency and then getting transferred over, and then it's the triaging is happening there.
Correct.
Great. Okay. Thank you. Great. Oh, I know one last question with the QMHP. Is there anything in Rep. Nathanson's bill that will impact, or how will some of those programs interact with mobile crisis work around care in the field and licensure?
Sure. So I assume you're talking about House Bill 4136. And that work was really specifically intended to be more physical health focused because we knew there was other work going on the behavioral health side. So the goal is a reduction in EMS and ED utilization, but most of the innovations will most likely be focused on the physical health side.
Although sometimes they're
Of course.
co-occurring, right?
Of course.
Yeah. Okay.
The only thing I would add, there are also initiatives, workforce initiatives at the state level. So there's a lot of work happening there. There's probably going to be a few asks in the next session around workforce, again, to kind of build on that and looking at that pipeline for behavioral health practitioners into the field. So there's a lot of work happening at the state level.
Great. Yeah, I know, I mean, that was a policy lab project, was that year before last, I guess. And I actually know decades, almost 3 decades ago, like the University of Oregon had a program, there was a real shortage of teachers in special ed. And so they had a tuition waiver or a forgiveness if you taught, I think, for 3 out of your first 5 years out of graduating from their program in the state. So there's models out there. Yeah. Okay. Great. Thank you.
Okay, so now we will invite up Incident Commander Brown and Sheriff Harold to speak to co-response and a little bit, we can talk about how it differs from mobile crisis, but also this was response to a board assignment around how this system is working for our law enforcement professionals.
Good afternoon, Commissioners. My name is Ray Brown, and I am the Downtown Incident Commander for City of Eugene and the Eugene Police Department. I hope I don't disappoint following Dr. Khashoggi. She is a gifted speaker. My role in EPD is I report directly to Chief Skinner, and my job is the strategic planning and operations related to public safety, cleanliness, and activating downtown at a high level. The downtown station, the substation, is down at 960 Olive. That's right down there by the bus station, the atrium, and the library. We're right down in the middle of things downtown. We've got 9 officers, a sergeant, and a station manager. And the downtown patrol team responds to anywhere between 24 to 36 calls on a daily basis between what's called in and what they initiate on their own. Our co-responder program is a partnership between the Eugene Police Department and Lane County Behavioral Health. It is a pilot program, and so it is not fully up to where it will be down the road. We're looking at this as phase 1. We're fortunate to work with mental health specialist Jose Manriquez, who we have hired under contract with Lane County Behavioral Health, and he brings a very high level of motivation to the team. It's a pleasure to have him there. Additionally, I've had the opportunity to work with clinical supervisor Jeremy Jalabert, and he's Jose's supervisor, and from the looks and the thumbs up, you're as happy with him as I am. He has done a great job, and I'd like to commend him publicly as well for the leadership he's provided in helping bring these 2 organizations together. He's been a pleasure to work with. We started our program, They Hit the Street, on April 8th, and that was the beginning of our deployment with the co-responder team. We did some onboarding on the 8th, and then on the 15th, they hit the street. The co-responder team includes a Eugene police officer, and they are consistently paired with the QMHP Jose, and he has supervision access through Jeremy. Phase 2 will begin at in October, and we have a grant from the Bureau of Justice Administration, $550,000, to assist with the addition of another police officer, another qualified mental health professional, and a peer support specialist to be part of that team. The co-responder, we basically have several objectives, and I'll go through some of those for you now. One of the primary is to reduce police contact on low to moderate risk calls. and address together the criminal and behavioral health elements that come in most of the calls for service downtown. The vast majority of calls that we deal with downtown are all three, between criminal, behavioral health, and substance abuse. Two of those three are almost always present, and often it's all three. We also look to address the public safety needs and decrease the likelihood of incarceration when it comes to those contacts. So if we can provide the help and assistance that citizens need as opposed to incarceration and find a better way to an end, that is the objective. We provide a stronger pathway to treatment for individuals with mental health, addictions, crisis, or co-occurring mental health and substance use disorders. The team conducts rapid behavioral clinical screenings, assessments. They do diagnostics out in the field. They do care coordination services for individuals with behavioral concerns that have frequent police contact. Additionally, they provide rapid access to psychiatric care. They initiate clinical and case management referrals. They provide triage, treatment, and support clients during court procedures at community court. So far, to date, they've only been on the street for less than 2 months, and so it's difficult to have any very meaningful data, but to give you a little bit of a flavor of some of the work they've been doing, daily they see about 6 to 7 unhoused and duly diagnosed adults in downtown Eugene. They believe they've made based on the numbers, they've made approximately 150 contacts, and some of those are repeat contacts from people they are starting to develop a relationship with and starting to move them towards a healthier lifestyle. They've screened 11 potential FIT program clients, and of those potential FIT program clients, 5 of the 11 have enrolled into FIT or another Lane County behavioral health program or service. As far as the outcomes we're looking for, in the end, we're looking to, in this trial pilot project, we're looking to have that fully staffed team of 2 QMHPs, the peer support specialist, the clinical supervisor, and the 2 officers that work with them as well. And like my colleagues have stated, staffing and making those hirings is going to be one of our major challenges moving forward in that arena. We want to improve downtown safety. That is one of my primary objectives, to make people feel downtown is safe and they want to visit.
Excuse me, sir, can you just pull the mic a little closer to your, thank you so much. Great, thanks.
Sorry. And additionally, we want to increase access to behavioral health services and reduce individuals' repeat encounters with the criminal justice system. That is, in general, a high-level view of what we are doing downtown with the co-responder model. If you have questions around more details, I can answer those. And I will be here in the audience and wait until we are finished. And I will let Sheriff Harold go unless we wanted to begin.
Chair Trieger and Commissioners, thanks again for an opportunity to join with this panel. I will say, agree with everything we've heard so far, but I'm hopeful as this program is building. Gotten to work with Ray Brown for 25 years, so he's had the experience of working with Cahoots in the city and now the co-responder model. Whereas out in unincorporated Lane County, we just really haven't had that resource. So earlier in the presentation, when we're talking about the non-co-responder model, I believe you all have heard me speak about as Western Lane grew, they started off just the city of Florence only. And I often gave the example, and it's because Chief Tom Turner gave it to me, of the trespass at the McDonald's in Florence. Rather than sending a police officer there to make a trespass arrest, Western Lane was oftentimes able to go there, offer alternate resources, and resolve the problem without the police department. And so I'm thrilled that we're moving towards a time when, it hasn't been that long ago, I was at a late evening meeting and I ended up helping a deputy who's assigned to Veneta. There's an individual at the Shell station still wearing a hospital gown. The Shell station wanted him to leave. He wasn't comprehending what was asked of him. He didn't have anywhere to go. So I'm looking forward to the day when we have a mobile crisis intervention service that can respond out there and resolve that call without a sheriff's deputy and the sheriff, if he happens to be in the area, going to that. But also, one of the things that Chief Turner and I talked a lot about Western Lane as we tried to expand that outside the city limits is ensuring safety of those folks. And so we really developed great working relationships with Western Lane. When we had deputies that were on duty over there and there was a call for service, the deputies were the first to ask for Western Lane's assistance. So we've done co-responder with Western Lane. It didn't look like what the state requires for this funding, as you know. But we've done it, and it was really successful. The other thing that co-responder happened in Western Lane was because of the relationship with the providers, there was proactive contacts also, not call-driven contacts, but proactive contacts to try and avoid the later 911 call, because you're keeping in contact, building relationship, hopefully, as was shared, getting people signed up for Fit Team or some of those other programs so that the 911 call doesn't happen. I'm confident that as this program grows, there's going to be the relationship building between the folks that are in the MCIS vans and the deputy sheriffs with respect to unincorporated Lane County. And it's going to be that resource that unincorporated Lane County hasn't had. And I think that there will be some opportunities for partnership on proactive calls where, hey, let's get out and try and make contact with so-and-so and hopefully get them engaged in services because they might be headed down a path that's going to become a 911 call. And as I already shared, I'm excited to have the resource for some of those calls where maybe we don't need to be there at all. Just going to continue to heap praise on Jeremy Jalabert because I've really appreciated him also. And he presented on the Eugene downtown co-responder model to the Mental Health Summit, and I very much enjoyed hearing some detail about some of those contacts in the jail diversion aspects. Because having that mental health provider standing next to the Eugene police officer, you all have heard us talk a lot. Police officers pretty much have two tools in that scenario. It's a criminal arrest or the ER. Having the mental health provider standing next to the officer expands the toolkit, and so that's what we're looking for is opportunities outside of those two. And we're headed in the right direction. There's lots of hurdles, and you all also know I share with the frustration at times that the state requires services and sometimes the funding lacks, et cetera. So you've heard me say that before too. But we're headed in a direction. Something's better than nothing, and so far unincorporated Lane County's had nothing. So I'm hopeful and optimistic and looking forward to it.
Thank you. Questions from the board about the co-responder model? Commissioner Farr.
Where do I begin again? I just as the been at work for 2 months now. Is that what you said?
Yes, sir, just under 2 months.
2 months, and already had 11 potential fit eligible individuals, of which 5 have signed up, 5 are enrolled. That is remarkable. Now, do you think that there was probably a big backlog to address initially, or do you expect that kind of continuation of response?
I think we're going to see that continue for a while. In downtown Eugene, we get folks who come through. We get some that have been in town for quite a while. Some of these 11s, probably 50% of those were calls for service, and the other 50% were proactive on the part of the co-responder and Officer Rankin.
Good. And then, you mentioned 9th and Olive has kind of been an epicenter of SOARs, and it really is for a whole lot of reasons. The transportation system is hubbed right there, and a lot of other services are hubbed very, very close by. So if you happen to sit on the corner of Willamette and 9th Avenue, or 10th Avenue, and look down at the DAC, and look down, you see your teams are pretty active down there on a regular basis. There are a lot of people down there, and you mentioned the 3 co-occurring, you said criminal, behavioral health, and substance. Often the individuals are engaged in all 3. So after we have 2 weeks to look at it. Can we take another look sometime, just a couple of months down the road, and have a further response to see how further report to see how that's going? Because I'm excited about the results that you're already describing. Are you a captain? Or non-uniform?
I am unranked, sir. I'm a
Non-uniform.
civilian employee.
Thank you. Thank you, Mr. Brown.
Thank you. Being no other, oh, Commissioner Buck.
Thank you. I'm actually really excited about this pairing. I think if we had more of it, we'd be able to deflect a lot of folks away from the jail or other services and provide them, you know, the needed engagement that they've been lacking probably for a long time. And I just wanted to share that I ran into Chief Skinner at lunch, and he wanted to thank the county for the work that primarily you and your teams have been working on for both these things today, both the mobile crisis and the co-responder. So it seems like, you know, the feedback is coming in, even though it's only a short time that you've been able to work through this, that so far we're seeing great results. I too would be very interested in a report later on when you think it's the right time to come back with some more results of the co-responder model and see if there's things that you suggest for tweaking it, or, I mean, whenever we go out with something new, it's never going to be the final version of the service we provide, depending on, you know, the needs of the people that we're ultimately trying to serve. So I would look forward to that.
Well, thank you so much. As I'm listening to this and I'm hearing, you know, what an incredible value add and how well it's working, I can only imagine when we get our stabilization center fully operational, the deflection program implemented, we really are making some progress on completing the circle of the system. So even if there are flaws and bumps and funding gaps and staffing issues along the way. So thank you very much. Appreciate it.
Thank you. And I think the final question then, should we close this board assignment or should we leave it open? Because I've heard a couple of commissioners request additional follow-up in some months' time.
Yeah, I think, I mean, for me, the intent of the assignment's been met. And I think the idea of bringing back a sort of update and how it's going and case numbers and so on is just sort of what we do with programs anyway, without it being an assignment specifically, but that's,
Yeah.
okay, great. So Tanya, I don't know if you followed that, but that assignment can close out. Thank you very much. Appreciate it. Thank you, sir, for being here. Thank you, Sheriff. With that, our next item, item 8B, still on Health and Human Services, is a board order that relates directly to the presentation and conversation we just had. And again, this is Director Gray's item on Order 24-06-04-06. And if you want to introduce the item, and then we'll see if there are any questions. Thank you.
So this is just adding the positions for the program we described, the mobile crisis program.
Commissioner Buck,
I'm prepared for a motion if we're ready.
please.
Do you have something?
If I may, a quick question, 41,815 gets us 6 FTEs? Wow.
So normally what we do when we price positions is they get priced for the remainder of the fiscal year, and then there's a price that occurs for the next fiscal year. So given how late we are in the fiscal year, that's probably why you see that cost.
Elaborate no further, thank you.
Yeah.
Commissioner Buck.
All right, I'll move approval of Order 24-06-04-06 as presented.
Second?
It has been moved by Commissioner Buck, seconded by the Vice Chair to approve the order. Is there any discussion to the motion? Seeing none, I will call for the vote. All those in favor signify with an aye.
Aye.
Aye. Motion carries 5-0. Approval of Order 24-06-04-06 in the matter of increasing appropriations in revenue and expenditures in the amount of $41,815.46 and adding one full-time regular clinical services supervisor position, one full-time regular mental health specialist 2 position, 7 full-time regular mental health associate positions, 4 full-time regular peer support specialist positions, and 1 full-time regular senior office assistant position in Fund 286 within the Department of Health and Human Services for mobile crisis services. Thank you. And one more item from Health and Human Services, and this is an order with a number of contracts and amendments. And again, Director Gray, if you want to just walk us through briefly.
So this is fairly routine. I think there's one or two new contracts on here for access centers that will provide access to social service supports. Otherwise, many of these contracts are related to the emergency order on homelessness and the all-in round 2 funding. I think there's also one for a contracted addiction provider who is just renewing a contract with us. Happy to answer any questions about any of these.
Great, thank you. To the board, any questions or a motion on this item?
Got a motion, Chair. I moved in the matter of approving 6 contracts and 7 amendments and delegating the authority to the county administrator or their designee to sign the approved actions per order 24060407.
May I second that?
You may, and you have. Moved by Vice Chair, seconded by Commissioner Farr to approve Order 24-06-04-07. Any discussion to the motion? Seeing none, I'll call for the vote. All those in favor signify with an aye.
Aye.
Aye. Motion carries 5-0. Approval of Order 24-06-04-07 in the matter of approving 6 contracts and 7 amendments and delegating authority to the county administrator to sign the approved actions.
Thank you.
Thank you, Director Gray. Appreciate your work this afternoon and always. Thank you. And we are now winding down. We do have a 3:30 time certain executive session, but we've got time. So we are on item 9, Commissioner's Business, and the first item, and pardon me, something in this room is making my nose run today. It stopped as soon as I was at lunch, and it started right back up. So pardon me. I wanted to provide an update on the process. As you all know, our lead county counsel is winding down her tenure with us, and this board tasked me with representing the board on a subcommittee to work on transition planning for interim services. And so I wanted to provide you with an update on that. There's a team of 7 of us to participate in the process to review and recommend a firm that can provide interim county council services. And this team is made up of our county administrator, Steve Mokerheisky, our HR director, Alana Holmes, myself representing the board, and then 3 members, also Ryan McBride, our talent manager who works with Alana Holmes, and then 3 members of the Office of County Counsel representing a range of types of roles within that office and longevity with the organization. And they are Deputy Attorney Andrea Nagels, our risk manager Lisa Lacey, and Assistant County Counsel Steve Teal. So we have solid representation from the office working through how to meet the needs of that office in the interim. The team developed a list of firms to outreach to, as well as some questions for those firms to respond to provide interim services. On May 21st, the Human Resources team sent inquiries to 6 law firms requesting the information regarding their ability to provide some interim services to the board for about a 6 to 9 month period. It was a 1-week turnaround, and by the deadline of May 28th, we had received proposal responses from 2 firms. 2 firms declined due to their own internal capacity issues. And as of the end of last week, one of the 2 respondents has had to withdraw their consideration due to potential conflict of interest. On May 30th, the team that I just mentioned of myself, the administrator, HR office folks, and 3 members of county council staff met to review the responses. We identified a firm to recommend. And in order to maintain confidentiality of the responding firms, we didn't want to publicly identify them until we had a accepted proposal that we wanted to invite them. But Human Resources will prepare a board order. If everyone here agrees to move forward, they will be named in that board order. That will be on our agenda on June 11th. So they will be identified with materials at that time. And if anyone on this board wants more information in the interim between now and then, the Office of Human Resources is available to fill you in a little more on that, but we're just wanting to protect the firms from a confidentiality perspective. So that is where we are with providing interim services. Are there any questions or concerns, and/or is the board prepared for us to move forward inviting a contract with this firm that submitted a proposal? Which I will just also share, this team, there was no concerns from anyone on the team about this firm's ability to perform the functions of interim services. Commissioner Farn.
Chair Trigger, you described a good panel of 7. What I would view as a very broad-based panel of 7, including 3 members of the existing council staff, 2 been here with us a long time. Thank you. The only question that I would have is sometimes we're not satisfied with only a single respondent. And at this point in time, we have a single respondent. Are we satisfied with a single respondent? Do we believe that we could put it out for another X number of days and have more to choose from?
I would say, and I welcome if our HR director wants to come to the table or the administrator, but I would suggest that we likely won't see a great deal of additional response. It was a pretty targeted approach. It's very specific services. It's for time limited. As I said, the responses that we did receive, there were no giant red flags or issues. And so we only need one. So yes, we only have one before us, but
that's a good
is
answer.
where we are.
Thanks. I'm cool.
Great. So I'm seeing, do you need more than head nods? That's official enough for great. Thank you so much. Appreciate that. Feels good to be able to move forward on that. Finally, as for the longer term selection process, this same review team discussed next steps to identify a search firm to assist us in filling the county council position. As many of you on this board know, we have used professional search firms before for high-level executive positions, and this internal review team, particularly, we relied very heavily on the Office of County Council representation to identify the questions and qualifications of a firm that would help us with the search for a Office of County Council lead counsel position. We talked quite a bit about the importance of finding a firm who has experience with executive leadership placement, but also specifically experience with with government entity, and also with legal experience. We talked about the right timeline, started to shape that, and HR is prepared to start sending inquiry out to several of the search firms. We generated a good list, both from the county's own experience and again from folks in the Office of County Council, not limited to the people on this panel that I named. And so we would be ready to bring back a recommendation to the board early in July for a search firm to engage in recruitment for the Office of County Council lead counsel position.
Excellent.
All right. Great. Thanks for stopping in, Director Holmes. Appreciate it. And that brings us to commissioner announcements. Are there any announcements from the board today? Vice Chair.
Love to announce this tonight is the opening baseball game of the Springfield Drifters. Starts at 6 p.m. at Hamlin Field. Looks like outside you're going to have to bring your hoodie and maybe a windbreaker, but we are hosting the first baseman at our house for the summer. Great kid, and he's super excited to be a part of a growing Woodbat Collegiate Baseball League. So everybody's welcome. And I think tonight, everyone who's a student gets in for free. So talk about family fun entertainment. Go Drifters.
Any other announcements? Commissioner Buck?
Thank you, Chair. I just wanted to mention that the Upper McKenzie Fire District just had their grand opening of their new fire station, which we all participated in helping fund. It's fantastic. It is a huge upgrade from what they had before, which was basically just a covered shed. And they have a new chief, and it seems to be a wonderful transition. So I just wanted to welcome the new chief, and if you have a chance to drive by, if you go upriver, feel free to drive by. It's really fantastic for the community to continue to see another building agency continuing to be rebuilt and gives them hope for the future.
Thank you, Commissioner. Commissioner Farr?
One of them's not really an announcement. I sent out a message. I have a 5 o'clock appointment this afternoon. That's not the announcement. But Ms. Monkreisky, the Local Government Advisory Committee, Association of Oregon Counties, OHA, we meet once a month. And you heard the discussion a little bit of the 1115 waiver. We talked about that, which is the waiver allowing, for one thing, allowing medical billing for adults in custody in the jail. We'll be having a further discussion on that in the next meeting, and I would point out that Director Gray is on that committee. That's a committee that I chair, and it really is making headway in having a one-on-one discussion with the Director of OHA and the Director of Human Services and the Director of Behavioral Health Services. So that committee, and thanks in no small part to Director Gray for the incisive questions that she's able to ask directly of the OHA Director. It really is well done.
Great, thank you. Well, I have a sort of announcement on behalf of a large group of constituents. Probably they have membership in every one of our districts, which is a local group called Moms Demand Action, and they wanted to make sure we and the public know this Friday is what's called Wear Orange. This is a national movement to bring awareness to gun violence in the country. And there are some local events coming up through the weekend, Friday, Saturday, and Sunday, but particularly our good friends at Palace Bakery, which I know a lot of us frequent. The owner there is a big supporter of this organization, and they'll be tabling there this Friday morning from 11 to 2. So if you wear orange in solidarity with working to prevent gun violence, they have some special discounts for you. They're doing some giveaways with biometric handgun safes at their tabling events. And, you know, the reason this is so important, I think, just a couple of statistics. In Oregon, the rate of gun deaths increased 31% between 2013 and 2022, a little bit less than the national increase of 36%. Oregon has the 23rd highest societal cost of gun violence in the U.S., costing $1,911 per resident each year. Gun deaths and injuries cost Oregon $8.1 billion a year, of which $89.1 million is paid by taxpayers. And I think of all the stats that they shared with me, I know every single one of us here cares greatly about youth in our community and in our own families. And guns are the second leading cause of death among children and teens in Oregon. In Oregon, an average of 34 children and teens die by guns every year. 58% of these deaths are suicides, 37% homicides. And in the U.S. overall, 31% of all gun deaths among children and teens are suicides, and 63% are homicides. These are all preventable deaths, and we owe a lot to this organization of dedicated volunteers who are working to reduce and eventually end gun violence in the community. So just encouraging folks to wear orange Friday, Saturday, and or Sunday coming up. Thank you for that indulgence. Are there future board assignment requests from the board? Commissioner Seneca.
Yes, I have one, and this could have been done during announcements part of it. Since we met last, Tiffany Harper Monroe had her young son, Justice Monroe. And I'm sure, as all of us are, we were very impressed that she, at 9 months, came down here to talk to us about redistricting. There's been a lot of talk about charter amendments, proposals on redistricting. I've been doing some research about the proposals, the process, and what has happened in the past concerning charter amendments. From my research, there have been 21 voter-approved amendments to the charter. Some of the items in the charter have failed initially, and then commissioners came back and adjusted them, and then they had passed. I noticed we had received a couple of charter amendments sent to our email from Bill Gary from Herring and Long. One housekeeping charter amendment, and the other is another proposal for an independent redistricting committee, or as he called it, the redistricting or Citizens Redistricting Commission. I'd like to move that we ask staff to review the language and prepare it for the general election and hold hearings on these two proposals similar to the other charter amendments that we have moved forward.
Let's second that.
Yeah, Commissioner Farr, please.
So if I understand that, this is a motion to instruct staff to look at the proposal and actually prepare prepare that as the one proposal?
Yes, I have spoken with staff, and it's very similar to the legislative language that we already have out there, so they said it shouldn't be a ton of work to implement that.
And is this in conjunction with, is it simultaneous with the recommendation of the Charter Review Committee?
Well, I guess we could agree upon either. It could either be done as the redistricting charter amendment or in conjunction with.
It seems like, based on just what you said, it seems like it is kind of the same thing that the Charter Review Committee has already recommended.
It's very similar. There are some differences. I've got them both all marked up, but they are both very, very similar. Yeah, it's very similar to the one the League of Women Voters put out. I'm sure everybody read it.
And if I may, Ms. Mokraski, is that a clear request to you?
I think so. Commissioner Seneca did chat with me at the break, and I suggested that we loop county council in to review that. There's been some correspondence back and forth on that, and just trying to get some understanding about what proposals the committee recommended and then where this fits in. I know the one comment that Steve Theo from County Council mentioned is that he has not completed a legal review of this proposal. So I haven't read the letter. I don't know. I'm sort of looking at this more from a process standpoint. I would suggest that we would need head nods from the board in order to incorporate it into the hearings on the 25th and or the 9th. My suggestion is just that you probably want to hear from county council on how that fits into the committee process that has already happened and the recommendations that happen there.
Commissioner Buck.
Thank you, Chair. I think my concern is that these particular recommendations haven't gone through our committee, which is normally, that's a whole process that we've been going through. We could ask the committee to look at these. It's still standing. The committee's still standing. And they're kind of ready if we want to ask them to do more. But we haven't yet. But the fact that we've had this committee and we've been vetting all the charter changes through them is the correct procedure to go through. I'm not exactly sure why these are coming outside of that particular process. Other than maybe they've just been hearing about what the committee itself has been doing. But I would feel more comfortable if we wanted to have the committee vet these requests first before they came back to us.
Thank you, Commissioner. And I see Mr. Teal from Office of County Council is online listening in. I don't know if you want to offer anything at this point, or we want to hear the rest of the commissioners' conversation. And again, we have a little bit of time still, but we do have a 3:30 time certain exact. So, Mr. Teal, did you want to weigh in at this time?
Good afternoon. I'll just add, just for context here, in speaking with members of the Charter Review Committee, the plan had been to prepare materials for the board to consider the 6 proposals that the committee has come up with on the June 25th, and then if necessary, the July 9th board meetings. That would require those materials to be prepared by next Wednesday, the 12th, for consideration at those meetings. Just to give the commission an idea, or the commissioners an idea of what the timeline looks like here.
Thank you, and I know we're pretty thin in the Office of County Council right now too, given the transitions and so on, so,
This is just,
so I do, I hear you, and I will recognize you in just a moment, Commissioner. So I appreciate you reminding us specifically of the dates. We do have charter review, or charter amendment consideration dates coming up. So if I'm understanding you, you're talking about how these materials might be prepared to incorporate into those to answer Commissioner Farr's question. Is that right?
That's right, Chair, and this is all kind of using ultimately the deadlines to be able to get things on the ballot for November and backtracking from there. I'm trying to build in some additional time for the board to consider changes and to bring things back if necessary. But just something for the board to keep in mind in terms of workload, looking towards getting things before the board by materials for the board by next Wednesday.
Thank you. Commissioner Zuniga.
yeah, absolutely. No, yes, under that consideration was why I'd spoken with staff about this before I moved it on. I mean, just to clarify, this is for the public hearing that a commissioner can bring a charter amendment to. It doesn't have to go through the charter review committee. This is coming from a commissioner.
Commissioner Buck.
I understand that. It just seems completely out of process because we've had the charter review committee going on to look at all this, and we've already proceeded to move forward with hearings on language that we've had work sessions about, and we haven't had a work session or reviewed whatever this potential language is as a group, and now it feels like we're running out of time.
Vice Chair. Oh, sorry. Oh, Commissioner Farr.
A question for Mr. Teal. If, for the, we're doing a tick-tock backwards from the November election, and so June 25th is with a potential early July, if we run out of time on June 25th. If, I think, is this the copy of the one that we all received, this, right? We will send to the entire board. For the work session on the 25th, would it work to insert this as the language for the Charter Review Committee, as a part of the presentation you were going to make on the 25th to begin with?
Well, I don't want to speak on behalf of the members of the committee. In terms of preparing materials for the board, I think Commissioner Seneca is correct, of course, that members of the board can make their own proposals, and the board can consider those, whether to go ahead with that or not. I don't want to speak on behalf of the committee in terms of replacing language that they proposed, if that's what you're asking, Commissioner.
Doesn't quite answer my question, but I guess close enough. Thanks.
If I'm understanding, Commissioner Seneca, are you asking you're not necessarily asking to replace Charter Review Committee recommendations. You're asking to add something alongside that is a sort of variation on something they've already put a lot of hours and time into vetting and presenting to us.
This would be added to said public hearing, yes, on its own merit.
So that's an assignment, right? It needs 3 head nods to move forward, to ask staff to prepare materials, to take this request from an entity to the commissioners and add it to the hearing on the 25th of June. That's what you're asking?
Yes.
So it needs 3 head nods to do that. Looks like it is.
I just want to reiterate the concern that we have with process and the fact that county council hasn't had a chance to review it before doing that. I think that's a big problem.
So Commissioner Buck, because I share that concern, and I would imagine that if in the course of preparing this, county council upon their review, essentially if they can't prepare something that aligns and that crosses all the T's and dots all the I's, then it won't come before us, and that will be the memo that we get, is they weren't able to. I mean, we can't make an assignment that compels them to do a thing if that thing doesn't pass legal review, right?
Yeah, I I mean, I suppose we still have the 25th where we could discuss that and then come back on the 9th and make any adjustments, right?
That's what I'm saying, though, that, right, is that right, Mr. Teal, that the presentation from your office or the memo from your office would say, here was what was asked, and it either is doable and here's how, or it is not for these reasons? Is that fair?
Well, if I understand the ask correctly, it would be to not only review, but then prepare, assuming that it passes legal muster, to prepare materials for the board to consider agenda items and actual orders related to these proposals.
So it would be part of the hearing on the 25th of that public hearing?
If that's what the board is asking me to do, yes.
And Commissioner Senega is affirming that is his request?
Thank you.
Okay. Are there, and then I have an assignment request. Anybody else? So that one received 3. Mine is really just a sort of restatement of this morning when we had several folks here from the Council of Pacific Northwest Carpenters, and it's really just to make it an official assignment so we don't lose sight of getting some follow-up on any potential issues with subcontractors, specifically at our South Lane Clinic project, but also generally around the community benefits bidding process, whether there are opportunities to strengthen that, that protocol to ensure subcontractors are meeting the anticipated and expected conditions that we place on them. Great, looks like every.
Question,
Yeah.
are you asking to also vet the incidents that happened as well, or just general?
My understanding is that representatives who are here this morning are speaking with staff about their specific concerns about a specific project. So that's part A, and then part B is looking at language that we might add to our CBB to strengthen it to prevent the kinds of issues that they're, the concerns that they're raising from happening in the future.
Yeah, good.
Great, that looks like everyone's nodding on that. So we have those 2 items, and then we'll have county administrator announcements. Would you like to review assignments and give us any announcements that you might have today for us? Thank you.
So we closed a couple of assignments. There was Commissioner Senega's item that received head nods. I don't know that that's an assignment. But we can debate that point. That was just to include the Harang Long proposal into the hearing on the 25th. And then Commissioner Trieger's request to both, one, look into the subcontractor worker issue in the South Lane Clinic project, and look at our community benefits bidding language to ensure that those types of concerns are addressed within the policy. Did I miss any other assignment?
What was the co-responder? I don't.
Yeah.
Yeah.
Right.
And then we also closed another assignment this morning. We closed the assignment on the community benefits bidding program.
Right,
Yeah, thank you.
The only announcement I was going to make is there was just a procedural question earlier in the meeting about consent. Commissioner Lovell asked about what the best way to handle if you have. So I just wanted to share briefly, since we have a minute. If you have an item like that, typically if you have an item on the consent calendar, a commissioner will pull it if they either have questions or if they want to vote against it, right? But you don't want to vote against the entire consent calendar. But in this instance, you actually had an item that included multiple contracts, and so in this case, Commissioner Lovell was stating that he only objected to this one. So the question was, should we pull that or not? And that's somewhat a judgment call for commissioners to make. If it's clear that, or it appears that a majority of the board may not support the item itself, then you may want to pull that and have a motion to deny that request, and then approve the rest of the matter. Does that make sense? Alternatively, I think the way that it was handled by Commissioner Lovell, where you stated, listen, I'm going to vote against this, my objection is really related to this one matter, not the entirety of it, gets your position on the record. And in this case, it was approved despite that. So I just for future reference, you have a few options to do there. Know that we do the board orders are the record of the action that's taken by the board. So anytime you take a vote, we try to have a board order on that. That's why there's a number. So you can look back months or years and go, what did the board do on this issue? And you can look that up. So just know that anytime you're taking a vote on something, in this case, if you're going to pull that item, and again, if you were going to deny that item, you could do that. The board could vote that down and then just approve the rest of it without that item in there, and that would have been fine. But in this case, it would have been a lot of work, I would argue, to pull that item, create a whole new board order to vote on it when it looked like it was going to, and it was approved anyways. Does that make sense? So I would say that was handled in the right way. It's a good way if a commissioner wants to vote no on an item to just call it out and say, here's why I'm voting no on this, so that your position is on the record. So there you go.
Is there any other business before I take the rest of our 10 minutes to read us into these multiple? No. Okay, so please bear with me all. We have multiple executive sessions. We have one at 3:30 p.m. today and 2 tomorrow. So the Board of County Commissioners will meet in executive session June 4th today, 3:30 p.m. to conduct deliberations with persons designated by the governing body to carry on labor negotiations. Today, June 4th at 4 p.m. to conduct deliberations with persons designated by the governing body to negotiate real property transactions. Tomorrow, June 5th, 10 a.m., to consider information or records that are exempt by law from public inspection and to consult with counsel concerning the legal rights and duties of a public body with regard to current litigation or litigation likely to be filed. And also tomorrow, June 5th at 1:30 p.m. to consider information or records exempt by law from public inspection. These executive sessions are held pursuant to ORS 192.6602D, ORS 192.6602E, ORS 192.6602F, and ORS 192.6602H, which allows the Board of Commissioners to meet in executive session for the purposes listed. Representatives of the news media and designated staff shall be allowed to attend the executive session. All other members of the audience are precluded from attending. Representatives of the news media are specifically directed not to report on any of the deliberations during the executive session except to state the general subject of the session as previously announced. Members of the news media are not allowed to tape, video record, or otherwise record an executive session. Verbatim notes are prohibited. No decision may be made in executive session. We do reserve the right to come back into public session should the need arise. At the sound of my gavel, we'll be in recess and reconvene at 3:30 in the small conference room for the first executive session.